Bill, they said I have a live wire coming in before you showed up. So what's your story? You're here to talk about your experience, I guess, as a patient getting cell therapy. What caused you to want to get it in the first place?
I wanted to get it to save my career. I'm a fire captain with the city of Phoenix, and I hurt my shoulder years ago. And being the aggressive people that we are, we just let things go and figure, it'll get better. But it didn't get better.
Yeah.
It just kept getting worse, and it became bone on bone, and came down to time to have a reverse shoulder replacement, and that would have ended my career. And I was terrified of that because I still have a few good years left, I believe.
Yeah.
You may ask some other people, they may say no. But
How long ago was that?
I injured my shoulder in 2011.
So it's been like 7 or 8 years. And then
Correct.
at what point were you starting to consider surgery as the only option?
3 months ago.
Just 3 months ago.
Yes.
Wow. And what did it feel like, your shoulder? Like, in other words, was it just lack of motion? Was there pain associated with it?
All of the above. Lack of motion, extreme pain. I couldn't breathe in without having pain. I couldn't sleep at night. Putting my turnout coat on was miserable. Throwing my SCBA bottle over my head to go into a fire was crazy scary looking. Made it happen, but it was ugly to watch.
So what starts to happen, though, is if you have that kind of a limitation, then they start to say, well, you can't really perform your duties as a firefighter.
You can't perform your duties at all. We go through a thing called minimum company standards every year, and I got to tell you, I've been lucky to pass it this last 2 years because of the pain. And that's when I decided to go for shoulder surgery. But if you have a full replacement, you cannot lift over a certain, I think they told me 35 pounds, because it would snap the screws out of the shoulder girdle. And so that ends my career. Totally ends.
Wow. Yeah, because you have to be able to obviously lift a lot more than 35 pounds.
You have to be able to do a lot more with that shoulder.
Now, you look like you're otherwise very fit, and strong. So it was just that one joint that was the problem.
Right. And my muscles have atrophied on the left side. And so when I heard about stem cell,
How'd you hear about it?
my backseat firefighter's sister works here. And she has been wagging her finger at me for months. Come on down, come on down. And their family, Steve's my brother, and finally came down, and she explained everything. She had been giving me literature for almost 2 months.
So what was your resistance that you didn't want to do it till you finally said, okay?
I had really no background on the stem cell process. And after I started researching it, and it seemed like magic to me, and I'm thinking, magic doesn't exist.
Yeah.
And it does.
Okay, so
It really does.
now you're leading to the next question, and so then you came in, they explained it, and you said, okay, I'm in. Obviously, your benefits probably didn't cover this, so
No.
you have to invest out of pocket for it.
Correct.
But to save your career, it could be worth it, right?
Correct.
So what happened? They did the treatment, and kind of just walk me through that.
Came in, and first you need to know that these are the nicest people on the planet.
Awesome.
You walk in and they make you feel absolutely welcome, takes any trepidation out of the process, and they explain exactly what they're going to do. And so I was kind of prepared for that. It's like having a cortisone shot in the joint. They numb you up a little bit and then stick the needle in, and then the needle, actually, you don't even feel the needle going in, but you feel the fluid going in a little bit.
Right.
And I had raw bone that has been being ground down for years, and so there's a little discomfort. It wasn't bad at all.
Was there some prevailing wisdom? Like, I imagine you're seeing an orthopedist. Did they think that this was, when the bone is ground down and worn the way it was in the joint, that he thought, there's nothing there to work with, so it wouldn't work? Or what was the...
That was the reason for them wanting the full reverse shoulder replacement, is because and honestly, prevailing wisdom says if you don't have bone and your rotator cuff is completely destroyed, you have nothing to work with, so you have to have surgery.
Did you tell them before the treatment that you were going to get stem cells?
Yes.
And what was their response?
He wants to know how it's working. Okay. Because they do the PRP thing that they inject, and that's the first step in any of their processes. So it's something that's becoming more and more mainstream.
So, okay, so you had the injection.
Had the injection.
That was 3 months ago.
Yes, I did a series of 3 injections. I did the 24 units. And after the first 2 days, I really felt like I was having the placebo effect, because I woke up one morning and thought, I slept through the night and didn't have any pain. And I was able to move my shoulder more than the 10% that I was giving. I only had 10% ability in that shoulder.
Wow.
So as the week went on, I realized this is not the placebo effect. I'm actually starting to get rotation back. And I can actually put my hands over my head now without any pain. And the only disappointing thing with the stem cell is I play guitar a little bit. It didn't make me a better guitar player. I just am really disappointed about that, because I thought for sure some of it would bleed off into my brain, and it didn't happen.
Oh, if that worked, I'd be the next patient in you.
I would want more. I would invest any amount of money.
Well, I keep buying better guitars, but somehow I don't get any
I know,
better.
throw money at the problem. That's what we all do, and it never gets anybody better. I do the same thing.
So you started noticing within days a difference, and now we're 3 months down the road. So where are you at now?
Huge difference. I'm at 70% motion. I've recaptured almost 70% of my motion. They told me that, it's not going to be, because my shoulder was so bad. And I brought in the CT scans and everything, and they looked at it and went, wow, man. And so I'm hoping for about 80%, getting 80% mobility back. But I'm at 80% pain relief right now. Wow. If I do stupid stuff,
it's gonna hurt.
You're gonna feel it, because this happened in 2011. I let it grind through to 2018. So it's not an overnight thing. And I still feel the stem cells working, because I'm able to do more and more as time goes on. Especially, I'm starting physical therapy to get those muscles working again, because they're all atrophied, and it just really, it's tough, because I don't feel the pain. I want to do the things, and so patience is part of the process.
Yeah, it's got to be a bit of a process to work through all that. And what's interesting is that there's a sort of ripple effect here, because now your career is way extended, it seems like, because you seem pretty young. So as long as your shoulder's holding up, you're good. And as you are in action doing what you do, which is life-saving, your ability to be able to perform those functions, is important for your community that you serve. So there's really a lot of pieces of this that start to say, wow, look at the effects, as compared to saying, now it's a surgery. Hopefully the surgery works. You're out of a career. I mean, the other path is a pretty dismal path.
It really is. And for some people, they feel like that is the only way, that's the only option that they have, and the only choice. And with stem cells, that option, there's a second option to help you out. And the downtime, 24 hours. They say, just don't do anything silly for 24 hours. And I hadn't been doing anything silly for two or 3 months before that, because I was done. I couldn't lift weights anymore. I couldn't run on the treadmill. I couldn't do skills courses, which is where we turn out, throw our bottle, pull heavy stuff, and do silly things. And we do most of our work on our knees and over our heads.
Right.
I couldn't do any of that anymore. My career was over. And now it's rolling back into where I'm getting stronger every week. Wow. I feel that. And the recovery period was 24 hours.
Wow. Versus
a surgery where you're talking 6 months before you start to do physical therapy.
It's interesting, because you used the phrase, it sounded like magic,
Yes.
and coming into this, in this whole process and Pain Revealed, and exploring all these things on the cell therapy side, I said, it's something that holds promise, but I was a bit skeptical. But I'm hearing too often, over and over again, a story such as yours, and especially with yours, very, very dramatic and very quickly. Really something that I think is important for people to be aware of, and I appreciate.
Absolutely.
Yes, I appreciate you sharing it. Any last thoughts that you might have around it?
If you have any questions, call. Yeah. Call somebody and ask. Get on, Google it, figure it out. Backs, shoulders, knees, COPD, folks with COPD. We ran into somebody on a call that we thought we were going for her, but we were going for somebody else. And her COPD had lessened by, she said about 50%. I'm probably going 10% because she's still huffing and puffing, but we weren't there for her. And she was pink and looking good.
Wow.
Stem cell is magic. Those cells go in and decide what they need to do. That, to me, that's magic.
Did you report back to your orthopedist? Did you have So tell me, did you go in for a new evaluation?
Yes, I did. I went in and I talked to him, and he said, far out, because he was not wanting to do the surgery. He told me, hey, to get you pain-free, you're not going to be on a truck anymore. You're done. Your career is done.
Wow.
And he's one of these guys that he didn't pressure me or anything. He was pretty excited about it.
How great is that?
It's pretty awesome. And I see stem cell in the future as being the first go-to for orthopedics and everybody else. But that's probably way down the line because there's money to be made in orthopedics, especially in surgery.
Yeah, and a lot of times, frameworks take a long time to change before new things are adopted. But wow, that's
right. There needs to be a paradigm shift, in all of us, and I've made that shift. I'm a believer now.
This is terrific. Thank you again so much for sharing the story.
You're very welcome, Doctor.